Following program are pre-recorded.
Talk of the Town on Super Talk 1270.
Super Talk 1270, year 2 to Talk of the Town. I'm Steve Bach along with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drug Store. And, recently we talked about oral health. Well, we've got a little extension of that we're going to review this morning because exciting news. You now in the store have... Okay, the cool way to say it is it's what the astronauts use.
Yeah. So this is a Dentaloo branded product. I've gotten to know a Dr. Arash out of Los Angeles, so it's through his company that I've secured these. They're called Advanced Gum Health. And last week we spent the program talking about oral health and how critical it is to our overall health. And at the end, I started to throw a word called protectant out there. These are a little different, but the science behind these is magical. This Dr. Emily Stein that I've gotten to know, I think she's a genius, to be honest with you.
Well, let's back up a little bit and talk about the Advanced Gum Health. So it says gums, but it's whole oral mouth care because, again, it's what the astronauts use. You don't just brush your teeth in space because you get toothpaste everywhere.
Right.
And, this is what they use. Yeah. So back up a little bit and tell a little bit about the methodology behind this.
So Dr. Emily Stein, she founded the formulation in relationship to her grandmother. She went to visit her grandmother in a nursing home, and she was in a memory care unit suffering from Alzheimer's. And she hadn't seen her for a while because she was out in Stanford, and I think she's from the Midwest. She went to school in Iowa, so I think she came back to the Midwest to visit her grandmother. And she was really taken back by the health of her grandmother's mouth because with her memory problems, she wouldn't allow anybody to brush her teeth, and she wouldn't do it herself. So she had been through months of no oral care for the most part. And Dr. Stein's a microbiologist. She has a PhD in microbiology and immunology, and she just felt that my world is bugs and trying to control them, and I need to try to figure out something that will help people like my grandmother, because the biofilm and the bacteria infection in her mouth was out of control. And she knew she had to try to do it in a means that was acceptable to somebody like somebody with Alzheimer's. And in 2010, she began screening what are called generally recognized as safe ingredients by the FDA to search for a combination that was effective and safe to consume in what her goal was, like something that we can sprinkle on food. So it's consumed as part of their regular daily life. And it took her a while, and 14 patents later, her studies have shown that Fosodent, which is a trademarked patent of hers, the ingredients, it addresses things like the acid production, biofilm production, and stops the growth of disease-causing bacteria that's associated with gum disease, but also things like cavities and bad breath. Last week I threw out
that was kind of just stumbled into as a byproduct.
And she really, the generally recognized as safe and effective, she was really dealing with outside of the drug market. She was looking to develop what she felt was a lot more natural way to chemically induce these bacteria and the things that cause oral health and gum disease, and the biofilm especially, to try to destroy. So again, it took her a while, but the research that she's done, and I've had the opportunity to meet her 3 or 4 times through Zoom meetings, and she's a smart lady, man. This gal she's amazing. And during her research, she gained a real understanding of how severe the oral care crisis is in the United States and around the world. So her company, Primal Health, is a biotechnology company with the goal of improving public health by developing groundbreaking supplemental dental hygiene products. And this is really one of the shining, I think it's a shining moment for her company. But she's doing a lot of research. She's looking at the development of a chewable toothpaste.
Really?
Her one of her goals is, do we really need a tube of toothpaste? Can't we chew on something and then put the brush in the mouth? So yeah, she's pretty
okay.
cool.
Every parent who's ever fought their kid brushing their teeth before they go to bed, it's okay. That's a little different. Attack pattern.
Oh yeah,
that might work a little bit better.
Yeah, she's thinking outside the box in this oral health thing.
Well, and where they started with the sprinkle stuff, one of the things I deal with, because I've got my dogs, and in trying to get them and anybody who's tried to brush a dog's teeth, now there's things you sprinkle on their food that can help with the gum health. Same as this.
Yeah,
I mean, it's down the same road.
It is, and it took me a while to secure the lozenges because there's a great demand for them, and working through Dr. Arash and his Dentaloo company seemed to be the most efficient way to do it. Primo Health is really a research company. Dr. Emily has left Stanford, and she now lives in Minneapolis, and she's trying to monetize her research and continue her research. But I got these, and right behind this is coming a product called TEEF, T-E-E-F, which is for dogs and cats, and it's
perfect.
It's really a powder you just throw in their drinking water to improve their oral health. And some of the visual evidence that I've seen in my conversations with Dr. Stein is she's seen dogs with terrible looking gums, and in
I've got an older dog
6 weeks
that I scale weekly.
Yeah.
And it's just an uphill battle.
Yeah.
And I've tried some of the different products that are out there, and nothing's really working. I'm really excited for TEEF to come out.
I'll get you some as soon as I get it, because I do have some ordered.
We're talking with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore. It's what the astronauts do. We'll talk more about that when we come back. This is Talk of the Town on Super Talk 1270.
Super Talk 1270. Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bach, along with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore. And we're talking about advanced gum health, so a little continuation of our conversation on oral hygiene. Okay, I'm reading the lozenges, and it's what the astronauts use, and this is how they brush their teeth in space. No animal testing, gluten-free, GMO-free, vegan for those that are concerned about that, sugar-free, dentist-approved, and made in the USA. Sounds good to me.
Yeah.
I mean, I'm thinking about the applications for this. So if you're on the go, busy, you should brush your teeth after every meal. That's what this is for.
Yes. Yeah.
So you've got a business luncheon, then you got to run to a meeting. That's what this is for. This is brushing your teeth without the toothbrush. Not to say you shouldn't use a toothbrush or your traditional forms of oral hygiene, but this is a supplement. That's even what it says on here.
Right.
It's a supplement. This is how to bridge that gap and get better oral hygiene.
So the dental community that I know, and even Dr. Stein, talk about, you brush your teeth in the morning, you break up some plaque, you might destroy some bacteria. By the time you're walking out the door, it's almost all back. We talked last week about the mouth being an incubator. It's moist, it's warm, there's food in there. These bugs, they grow rapidly. They team up. They form this biofilm, which really is the start of plaque and gum disease. But the critical thing about that is these bacteria then escape into our body. We swallow them, we breathe them in. They're hard on our heart, they're hard on our brain function. So her research on this, and the original patent that she had, the product is trademarked. It's called Fosident. And again, last week I threw out the term Protectin. Now, Protectin is a little bit of an advanced formulation, And in a conversation with Dr. Stein this week, she explained to me some of the deeper science in her research. And this is a pretty simple formula. Fosodent it's a calcium carbonate, sodium bicarbonate, vitamin B6, and cyclodextrin. Now, cyclodextrin is a prebiotic. So cyclodextrin feeds bacteria, even the bad guys. So sometimes prebiotics aren't right because you have a population of bacteria, and people take probiotics and then they add a prebiotic, but if they've not shifted the colony of organisms in a good way, they're also feeding some of the bad guys. So in a probiotic world, we're trying to get people to control their dysbiosis, which is the ratio of good to bad bacteria, in a good way so that when they do a prebiotic, they're feeding the good guys. And similar in this world, so cyclodextrin being a prebiotic, that's really the grounds that she's standing on. This is a prebiotic for inside your mouth. Well, you just said that we need to make sure that we're not feeding the bad guys. One of the things that she discovered is the amino acid arginine is critical in making sure that the bad guys are dying off. And why isn't arginine in this? What I learned from her this week is her simple combination in this advanced gum health product, the bacteria that die off put out arginine. And so they're making arginine that destroys themselves. So they're literally committing suicide. That's apoptosis. That is bad cells dying off internally. So to me, that's amazing. If you use 2 to 4 of these a day after meals, every time it's in your mouth, these bacteria are self-destructing just because of the mechanism of action of what she's patented. It's kind of unlike anything that I've ever seen.
So that methodology, if you're thinking about it, so it comes in a pill form, but it's not a pill. You don't swallow it.
Right.
It's a mint.
Yeah.
Probably the best way to describe it. It's like popping an Altoid.
We got them on Friday, and I busted open the box and started taking them myself, and they take a couple minutes to dissolve. Very pleasant. So
now you mentioned the after, because one of the things on the label is after brushing. So, because you mentioned that your population of bacteria, your colony of bacteria, right about back to where you started by the time you walk out of the house in the morning after you brushed your teeth a little bit ago, and that's why this says after brushing as well. So you could take these anytime.
You can use them anytime. I would suggest that people that are suffering from halitosis or bad breath probably use them as often as they need until they get that under control. Here's a couple clinical study results from her. And it was data that it was accumulated in 2019 when she was doing her research at Stanford. 70 of those patients that used the Fosodent lozenges on a regular basis, 76% showed a significant improvement in gum health. 100% showed a significant decrease in the bacteria that science is linking to gum disease and Alzheimer's. 100% of the bacteria in the mouth that are linked to one of the causes of Alzheimer's are destroyed by these lozenges. And 82% of the population showed a significant reduction in bacteria caused by bad breath.
Okay, my wife says I'm forgetful, so I'm going to need a bigger bottle.
You're going to need... I think one of her websites has a 400 lozenge bottle. So it could be done.
But when you're looking at big picture, this is such a little fix to such a big issue.
Yeah.
It's amazing.
It is incredibly amazing. And the more I talk to her, the more I understand her mindset and, how do we attack this biofilm and these bacteria, because we're not very good at it to date. So we've had them since Monday in the store. They're not even out on the shelf, to be honest with you. But I've had I've had 4 people in where we're assessing that part of their problem is their oral health and the buildup of biofilm. One of our regulars is suffering tremendously from chronic candida and yeast, and if he eats a simple food, a sugar or has a beer, his sinuses are so inflamed that he gets so much pressure. And in conversation with him, and he said, my wife tells me my breath is awful. And in conversation with him, we kind of thought that maybe the origination of his sinus problems is starting in his mouth. Now, it'll be interesting because he's going to do 4 or 5 of these a day. It's going to be interesting to see down the road if that actually is true. We're theorizing, but he's been every place. He's tried everything. So I think for our overall health, it's one of the things that there are some things I think everybody should do. Probiotics, fish oils, get your vitamin D checked. This now comes right up to the top of the list for me.
Advanced Gum Health promotes healthy gums and teeth. It's a mint, but it's also how the astronauts brush their teeth. It's pretty amazing stuff. We're talking with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore. This is Talk of the Town on Super Talk 1270.
News Talk Bismarck Mandan. Super Talk 1270. Welcome back to Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bike along with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore. And we're talking about the oral health, and we're going to transition a little bit. But I do want to remind me, because we need to talk about at the end, your YouTube channel. I went through and went back on some of the episodes. Fascinating stuff.
Yeah.
Now, there's going to be a YouTube with video with the oral health.
Yep.
Are you going to get an astronaut to cameo there?
Maybe NASA.
Live from the International Space Station?
Maybe NASA will let me talk to him.
One of the other things, and we've talked about this a little bit because it's in the news, it's out there in the public, not always used correctly, but semaglutides.
Yeah.
And kind of a be-all, end-all for the latest. And I'm going to say this carefully because it's not what it was invented for, but dieting has been a fad or a craze. It's the next best thing forever.
Yeah.
Is this that? And I have a little fear about that because you and I have talked about, okay, well, people just go, hey, take a shot and I can drop 20 pounds. I can drop 50 pounds. This is a diabetes medication originally that has some side effects, some good, and we've talked about some that are bad. So you have to be careful with it.
Yeah.
Now, is it a way to maybe get a jump start or in addition to, but you got to make the lifestyle changes, and we've talked about that a lot, or if you're using this as weight loss, it's just going to come back. And it's probably going to come back worse. And you're going to have some other, bone loss, muscle loss on top of that, which could put you in a worse position than when you started. So we have to be very careful about how we discuss or how, as part of a triad of health, how people utilize the different tools that are out there.
Yeah. So a couple of weeks ago, we had one of our pharmacists, Jeff Gorder, in who he's an athlete. He's fit. He has a very strict regimen of.
He's one of those single-digit body fat guys.
Yeah. And so, but he's very knowledgeable about things like this. I'd encourage you to go back to one of the Talk of the Town episodes where we did a real deep dive on these GLP-1 peptides for weight loss.
And you pulled all these up off the podcast.
Off the podcast, or you can go to our website. There's a Talk of the Town tab on there.
Your website and the website, your website is great because you've got those and, like I mentioned, that YouTube channel. So you can. There's a lot of information out there. Yeah,
we call our YouTube channel Serenity University. So in association with our our supplemental line of Dakota Serenity Nutrition. Serenity University is our education piece, and that's really what we're trying to achieve with YouTube is education. Much like the things we talked about with the Posident lozenges, there'll be a lengthy video done on just that, so people can go there to refresh what we talked about. Same with the GLP-1s. We did a video with nurse practitioner Mick Peterson, who rents space in our building. Him and I just had a conversation about this, what he's seeing, some of the pitfalls, and some of the things that he's trying to get his patients to engage in to make sure that these things are safe. We just don't know the long-term effect of something like semaglutide or a GLP-1 peptide on the body long-term if you're not a diabetic. So they're used in diabetics because it does decrease their risk of things like heart disease and kidney problems. It's very
you have to weigh
effective.
the benefits for anything.
Yeah,
it's
exactly.
Like, okay, you're diabetic, you're morbidly obese, but is the cure worse than? Yeah. But hey, you're not going to potentially have heart disease on top of everything else. So you have to weigh out, and that's where talking to your medical provider is very important.
It is
why you're part of that triad of care. It's like, okay, what are my concerns?
Yep.
And hey, I got a history of heart disease in my family. So on top of this, it's more beneficial for me to drop 30 pounds than it is to worry about something else. Yeah. So I mean, there's a balancing act. There's a juggling.
There is, and I think if these medications are used properly in the right person for the right reason, they can be extremely beneficial to somebody's overall health. And the problem that we're seeing is when these drugs slow down your GI emptying, so you have a feel of fullness long term, so you don't eat as much. But like Jeff and I talked about, if you're using empty calories and you get full quicker and you're not getting high quality foods, you're not doing yourself any favors. So we've really started to roll out a program with a different delivery system that we did talk about. We're providing practitioners with a customized form with dosages, and this is actually a sublingual compound that we're doing, and that means it's put into the mouth, it's held for 90 seconds to a couple minutes, it's absorbed through the tissues in the mouth, which is pretty difficult to do because the peptide molecules are large. We call them chubby molecules. But the company that developed the base that we're using has proven they can diffuse the peptide through the tissues in the mouth, really more efficiently than if it's swallowed. Because there's some tablet forms of these drugs, and they're very, very, the bioavailability, which means from your GI tract into your blood system, is really, really small.
Well, and you and I have talked about less is more sometimes. Yes. So the ability to have because right now, for most people, it's you get a shot once a week or whatever that regimen looks like. But quite often, if you're getting a shot and if it's into fatty tissue anyway, you're going to wind up having to get a bigger dose to get results. So you and I have talked about less is more a lot. Yeah. And a better delivery system, oral delivery system, can potentially allow smaller dosing for better results.
That's our hope, because we really don't know. This is really all new. There's a group of us compounding pharmacists. We're getting together once a week, every other week, just to trade case studies, get some ideas on dosing. One of the problems, I think, without good guidance, and go to the website and just Google semaglutide. You're going to see places to get this stuff all over the world, and it's delivered to your home. And without good guidance, we're seeing that, even the prescribers are pushing the dosages to the maximum that really jumpstarts your ability to lose weight, because that's their goal. As an internet provider, they want you to lose weight. So they're going to push the limits to make sure that you do, because you're going to be satisfied until you get sick. And one of the main side effects of these medications, and even for diabetics, is nausea. One of the pharmacists that's on our team that are meeting, they're compounding an injectable semaglutide, and they're trying to transition people into these sublingual dosage forms, because Chris says every single patient that injects these drugs get nauseous. And that's the slowing down of your gastric emptying time.
Well, and a lot of that, in my mind, comes back to the dosing and such large dosing. It's you dose to you get those side effects and the nausea, and then back it off a little bit. That's kind of what the protocol is right now.
It should be, but that's not always what's being done.
It's not always what's being done.
Yeah.
We're talking with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore. This is Talk of the Town on Super Talk 1270.
Super Talk. Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bach, along with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore. We're talking about semaglutides and how the diabetes medication has turned into a weight loss quick fix, I guess.
Yeah.
We'll call it a quick fix.
It can happen fast.
Again, this comes back to dosing, though, and there's some concerns about dosing things.
Lot of concerns. And what happens after? Or do people have to use these medications, for life? They're expensive. Sometimes insurance doesn't pay for them. FDA is approving a couple forms of these medications for weight loss. There's actually a lot of research.
Specifically for weight loss, not for the diabetes side of this.
And so, as I mentioned in our show a couple of weeks ago, our hope is the industry is really doing diligence on dosing for weight loss, not just transitioning a drug from one indication to another without doing a deep dive on what's best for the patient. So we're seeing people do these injections once a week. Sometimes they're pushing that a little bit so they get more rapid weight loss. I really believe that's a problem. And without the lifestyle changes, they're just really not doing themselves any favors. So one of our goals with the sublingual form is backing off on the dosing, going slower. And I know that's a hard thing for people when somebody else they know is doing an injectable and just dropping weight like crazy, but I've never felt that rapid weight loss is a good thing anyway. Muscle's heavier than fat, so we can initiate the loss of muscle mass before we start to lose that fat. That's not what we want, because good muscle, lean muscle burns a lot more efficiently, so that balance needs to be in place. So we're putting together information for patients that helps them in their food choices. We're not dietitians, but I think we have some pretty sound data, especially with Jeff in the pharmacy, on things like how much protein and the percentages of proteins, the carbs to fats. These injections are anywhere from a half a milligram to a milligram at a time. So with our sublingual dosing, we're recommending a quarter of a milligram to start. And again, this is put in the mouth and absorbed through the tissues in the mouth into your system. And that's not as efficient as an injection. So, and we're recommending twice a week. This is a slow process. We've developed a customized form for practitioners with 4 dosage recommendations, recommending they start at the lower end and gradually increase that. We're talking to patients ad nauseum about the first dose, because we don't know for sure. The first dose may not let you lose weight, but we want to make sure that you don't, get any side effects. One of the things our pharmacy team is really preaching to each other is don't ignore the side effects. If you have a patient that's getting nauseous, don't ignore it. That could be the start of a side effect that you don't want the patient to have to deal with. So we're recommending a twice a week, then to a 3 times a week, and then slowly increasing the amount that you use to half of a milligram twice a week up to a half of a milligram 3 times a week. Again, that's in the mouth, held for 90 seconds to 120 seconds, and then swallowed. But the majority of it, we're hoping, is absorbed through the tissues in the mouth.
You know, you go back to the science of this, and one of the things I'm always a little cognizant of is how long it takes for results to come in so that you're not seeing damage in other ways.
Yeah.
And this is so brand new. And people just jump on, especially a weight loss, hey, take the magic pill. Which right now it's a magic injection, but you're working on the magic pill or the oral dosing of this. And again, what makes the most sense to you, and you have to have that conversation with your provider.
Right. And so many people in the country and even the world they're logging into these websites. They answer a few questions and then they get a shipment of an injectable drug without that triad of care being in place. And I think that's the rocky road. And our goal is really to make sure that your provider and our pharmacy staff are part of the team that can help educate you. So again, Jeff is, he knows this stuff. We put together a little bit of a guide on how much because protein is so important. Again, if you're eating simple carbohydrates and you're not hungry, suddenly you're full and you have not had any quality. You have not had any protein. So in Jeff's world, he says we should be ingesting 0.7 to 1 gram of protein per pound of body weight. And that's a lot of protein.
And all proteins are not the same.
That's right.
That's the other part of this, and I think people forget, all proteins are, just because you buy a tub of protein off the shelf, it doesn't mean it's good protein.
Right.
Because the fillers that are in there, too much sugars, the type of protein, it all plays into, are you getting the proper protein and the proper supplement for what you're putting your body through? And I had a friend of mine, and she never referred to food as food. It was fuel. Yeah. And how you fuel your body and your system.
Very
body.
True.
And it's
very
true.
Yeah, yeah. And, you know, some of the nutrients associated with that. B vitamins turn your food into fuel. So if you're going to do a smoothie, using a protein that has some nutrients, maybe some amino acids, some fibers, because two of the most important things in this semaglutide world are adequate protein and adequate fiber. And third is hydration. Because if we're going to slow down the gastric emptying time, we have to make sure that we don't stop the gastric emptying time. So we need adequate fibers. Your fiber servings need to be often and small, so we don't cause a blockage. But those are all things that we're really gearing up to help patients make those decisions.
Again, a lot of this information on your YouTube channel, Serenity University.
Yep.
A lot of things are on there. If you want to find out about the lozenges, you want to find out about
methylene blue.
Methylene blue.
Yep.
So many different things we've talked about and so many things you've been working with as a compounding pharmacist. There's a lot of information out there. That would be a good place, I would say most people should start, is go to your website, watch some of these videos, and then reach out to you guys directly.
Exactly. So go to our website. In the upper left corner, there's a bar with Facebook, YouTube, and some of the landing sites. If you click on the YouTube channel icon, it takes you to the YouTube channel, and it drops you into what are shorts. And so these are 1 minute introductory, what to watch for. Just move one to the right and click on videos, and that gives you the 8 or 9 minute videos that we've posted that are really deep dive on the education on a lot of the things we're doing. So if you have a few minutes, that's where I would go. And We can see the view times when we do analytics. People are watching some of these for the length of the video, which is kind of unusual in our world nowadays. So we're pretty pleased.
Just a piece of it, though, because after you watch those videos, after you do your homework, your research, reach out to Dakota Pharmacy and Dakota Natural Health Center.
Yep, exactly. We're at 705 East Main in downtown Bismarck.
Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore. This is Talk of the Town on Super Talk 1270.
Talk of the Town, weekday mornings starting at 9 on Super Talk 1270 and the free Super Talk 1270 mobile app. Without apology, The Regular Joe Show with Joe Gigante. Weekday evenings at 9 on Super Talk 1270 and the free Super Talk 1270 mobile app.
Portions of the following program are pre-recorded.
Welcome back to Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bakken, and joining us on the program, Jay Steckler with Essentia Health. Jay, thanks for coming in. Wanted to talk a little bit about, well, first your background, and then we're going to talk about vertigo, and that's something that maybe not a lot of people know about until they have to deal with it. Where do you come from, and how did you get into kind of specializing in this line of treatment?
Thanks, Steve. Thanks for having me on the show. I've been a physical therapist now for a little over 20 years, and I've been with Mid-Dakota Clinic, now Essentia Health, for about 16 years. And I've had extensive training, graduated from University of North Dakota.
The cool school, yeah.
Yeah, exactly.
I went there too.
So graduated from UND, came to Bismarck, got a job with Essentia Health, and been practicing as a physical therapist there. Now for the past 13 to 14 years, I've actually specialized in treatments of vertigo and dizziness type conditions. Been trained quite extensively out of the American Institute of Balance down in Tampa, Florida. And have taken several different courses on it to advance my skills, and taken even advanced courses so I can handle some of the most difficult cases of vertigo as well.
Explain vertigo to our listeners that may not know, because a lot of people aren't really aware of vertigo until they have to deal with it. For those that may not be familiar with the condition, a lot of different causes, a lot of different factors. There's different aspects of vertigo. Define vertigo for our listeners.
Okay. Well, vertigo is actually just a symptom. Vertigo is actually the sense of room spinning. Like the room is spinning around you, or you're spinning in the room. It's a sense of spinning. So what causes that symptom? And that's where the root cause is, and that's where we would get down to, getting down to the cause of what's causing the vertigo.
Because that's symptomatic of a lot of different people go, oh, well, I got this. Okay, but yeah, that's just a symptom of what's the deeper cause.
Right. And actually, people can actually describe vertigo as not even a room spinning sensation, but just even a general sense of dizziness, a sense of wooziness, a sense of imbalance, unsteadiness, lightheadedness, just a general feeling of like just a constant motion, or like a rocking or a floating sensation even. So I've had a lot of people not describe it as vertigo, but describe it as any one of those.
Or a motion sickness.
Exactly. Right.
And they maybe not realizing that there's something bigger
that
underneath.
Them. Right. Yep. And vertigo is one of those conditions that, to feel, some people describe it as like, I went to the emergency room because I felt like I was having a stroke, or there was some severe going on. And then all the diagnostic testing that they do, MRI, CT scans, heart tests, everything, don't show anything. Everything comes up negative, and so it leaves them feeling hopeless, like a sense of nothing's going to help, when in fact there is something that can help them get over their symptoms, and that's physical therapy care for the vestibular system.
Root cause. Okay, so a lot of different things come into play. What are some of the typical root causes of the symptom of having vertigo?
Yep. So some of the most common causes of vertigo or troubles with the vestibular system, one can be a head injury. If you have a concussion, or if you not even have a concussion, but if you just fall and bump your head, or if you're in an auto accident and you get whiplash, that can cause some vertigo symptoms.
Something a little out of whack.
Right, a little out of whack. But the most number one cause of vertigo or dizziness symptoms can't even be explained, because it just comes on in people's lives. The older you get, the more prone or positioned you are to getting vertigo.
Well, and I've talked to some people that have dealt with vertigo, and it comes back to their ear system or hearing, or things a little out of whack with that portion of. That's where
the main trouble lies, is in the inner ear. But what actually makes it go into a debilitated state can be caused by a virus, can be caused by, like I mentioned, just an accident,
bad ear infection,
or an injury. Bad ear infection can be caused by allergies. Can be, and like I said, it can just even come out of nowhere.
Well, and Kevin Oberlander and I, Dakota Pharmacy, have him on the program every week, and we talk about how all the systems are interconnected.
Yes.
And if one little thing way over here is a little out of whack, it can throw something way out of whack way over there on the other side of your body. And that's kind of the way some of the vertigo symptoms work, isn't it?
Absolutely. I was just going to mention some of those things that seem to come out of nowhere can actually be predisposed to heart conditions, diabetes, like I mentioned, allergies. It can be predisposed to a history of migraines. It can be predisposed to a number of different conditions that, like you said, are affected throughout the body, but then end up in the inner ear or causing problems in the inner ear, and then causing vertigo symptoms.
So when you're looking at those root causes, and you know, for me, my familiarity, a lot of it's the ear. You mentioned the heart. You mentioned some different conditions like diabetes. And I kind of break it into two different spaces. One is chemical imbalances, and one are physical imbalances.
Right.
So you mentioned maybe you bump your head, and that would be the physical aspect of it. The chemical aspect of it would be the diabetes. Or I always look at things work best in equilibrium. Things have to be in balance. We have to be in balance. What are some of the other physical versus chemical attributes to vertigo, which of course is a symptom of something else?
Right. So coming back to linking it to like diabetes or like heart conditions, it's not that the condition itself causes the vertigo, but it causes a lack of blood flow to the inner ear, which then breaks down a concentration of the nutrients that are in the inner ear that can lead to a condition that would cause vertigo, if that makes sense. And then also, yes, it can be a physical condition, not just a, like you said, a chemical or biological condition, but it can be a physical condition where you have like a head injury, or not even a head injury, but well, let me give you an example. The most common cause of vertigo is something called positional vertigo, and it's caused by a disruption of the inner ear to where little calcium rocks or little calcium deposits in the inner ear become displaced, and they get into an area where they shouldn't be.
Hold that thought. I want to come back to that a little bit, because I know people have gone to chiropractors or physical therapists for some of that, and I want to get into that a little bit more. We're talking with Jay Steckler. He is a physical therapist with Essentia Health. This is Talk of the Town on Super Talk 1270.
Super Talk. Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Beichel, along with Jay Steckler. He is a physical therapist with Essentia Health. We're talking about vertigo, and we were talking about some of the ear issues and the calcium. A lot of people may know that as crystals, because I've talk to people that, my chiropractor fixed this. And there are chiropractors that can be trained in some of that, because a lot of with the crystals is, again, things are out of alignment, out of place. And it's kind of a repositioning of those calcium crystals that are in the inner ear that maybe get a little whack. But a lot of times it's, if you're out of adjustment or out of sorts. And again, I'm a big believer in things in equilibrium. Things need to be in balance. Things to be in alignment in all the body systems. And whether they accidentally stumble on that as a cure, or there can be chiropractors that are trained in that area as well.
Right. Yeah, so chiropractors can be trained in this as well. I don't know of any off the top of my head that are trained in it.
I don't know any in the Bismarck Mandan area for sure. So
because they do more spinal alignments. And so some of the repositioning that we do is not necessarily with the spine. Not that doesn't help, but it's again more the inner ear. So these calcium deposits, they break free in the inner ear, and they're almost free floating, because the inner ear is basically a closed system that has a bunch of fluid in it. And these calcium deposits get into that fluid and they float up into an area to where they shouldn't be, and they get trapped. And so what happens is they cause a major disruption in that equilibrium, or in those signals that come from the inner ear to the brain, and the brain gets mixed signals and it doesn't know where you're at and what you're doing.
Kind of like they form a little dam where there shouldn't be a beaver dam.
Yeah, it causes those vertigo symptoms to happen, or that sense of spinning. And so what we do is we discover, okay, which ear is it happening in? Where are these calcium deposits not supposed to be, and where are they at currently? And we do different head repositioning maneuvers to where we tilt and turn your head different ways to get these calcium deposits to come back out and to go back to where they should be.
That seems like such a simple solution for some symptoms, but it's really not. Explain that process, because getting the right diagnosis to go, okay, that's the issue, and finding that there's a long lead up to goes to that's how we need to treat this. Right.
So there are various different areas in the inner ear to where these calcium deposits can be, and they're called semicircular canals. Basically, these are canals that detect motion, detect every
little snails.
Exactly right. And they detect motion to where they send signals to the brain, telling your brain exactly where you're at, what you're doing. Well, there can be different areas to where these calcium deposits are in or shouldn't be, and then we're trained to discover where they at, so that we know which way to tip and turn your head to get these to come back out to the right place again. And it sounds easy, but it can be complex, because there are multiple different repositioning maneuvers that we can use, and we got to use the right one to get the results that we want.
So what's the diagnostic pathway to go, okay, there's crystals here, because you mentioned there's different positioning movements, but to know which one, how do you get there?
So how we get there is when you're in clinic with us, we'll actually put you into different positions that may cause your dizziness. And that helps us to lead into knowing where these calcium deposits are at. Also, what it does is it creates a symptom called nystagmus. And nystagmus is a involuntary beating of the eyes, or it's like a reflexive motion in the eyes, because the same nerve that runs from the inner ear to the brain also connects to your eye reflexes and helps your eyes stay righted to keep you balanced. Well, when you get mixed signals to the brain, you also get mixed signals to the eye reflexes. And certain eye reflexes will actually point towards a certain area in the inner ear. So the way that your eye is beating, or the way that the nystagmus in your eye is actually going when you're dizzy, tells us exactly where those crystals are at, or where those calcium deposits are at. And so we know which maneuver to use to help get you righted and get you back to feeling good again.
Okay, we covered the ear side of that. Yeah. Now, you brought up a great point. Great segue here is going to the eye, because people with different eye conditions can also cause vertigo.
Right. Yeah, so different eye conditions. So we're not talking about like glaucoma or anything like that, macular degeneration. But
a lot of time, doesn't it come back to the lymph system and blood flow, and
that more affects
it's more
the health
pressure
of the inner ear.
Yeah, and
but it's more some of the reflexes that come from the eyes. So some of the sensory inputs that come from the eyes actually affect the reflexes in the inner ear. So what one is called your VOR, or your vestibular ocular reflex, and it's basically the reflex that helps athletes run down the field and help them keep their eye on the ball while their body is jostling and while they're running. They can keep a direct focus on that ball and see it clearly because of that VOR reflex. When you have a disruption in the inner ear, that VOR reflex can be disrupted, and it can cause a bunch of problems, because it's a reflex that we use even when we're walking down the aisle of a grocery store, and we're trying to find something on the shelves, and we're trying to look at it, and we're walking down, and you're walking back and forth, heads moving back and forth, and it can cause some major dizzy symptoms if that reflex is not intact, and it can cause some of those major vertigo symptoms.
Well, just going back to the athletes for a second, that's why concussions are such a big deal, because you throw all of those systems out of whack. And you mentioned, you could bump your head, and that could cause vertigo symptoms. And that's one of the big symptoms with a lot of people that have concussions.
Concussion, yes. Yep. And so, we actually do concussion management as well.
So when you're looking at the different aspects that can affect somebody's life with vertigo, and I know people that have lived with vertigo for a long time, is it because they haven't found the right treatment path, or is it they just haven't been connected, or are there cases out there that are just at this point unsolvable?
I will say this, that yes, can we solve every case? No, I'm not going to guarantee that. But there are a lot of people out there that feel like they've had vertigo or have had vertigo for years upon years, that they feel like there's no help, or there's no resolution to their symptoms, or there just can't be anything, because they can't find any positive tests. They can't find any positive diagnosis. I've had many patients come into my office having vertigo for over 5 years, 10 years, and we've helped them. And we've given them that sense of getting back to normal again. So even cases like that, to where they've had it for 5, 10 years, 15 years, can be helped in just a few treatment sessions, to where we get them back to normal.
When we come back, I want to go down a little bit different path, because I want to talk about some of the debilitating aspects of this, and some of the, I don't want to call it misdiagnosis, but again, people have to know to ask the right questions and not settle for things, because we do that. I don't want to go to the doctor, I'm tough. We do that a lot. This is Talk of the Town. I'm Steve Bach, along with Jay Steckler, his physical therapist over Essentia Health. This is Talk of the Town on Super Talk 1270.
The Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bach, along with Jay Steckler. He's a physical therapist over at Essentia Health. We're talking about vertigo this morning, and I am a big believer of the triad of care. And you need to be your best and your own advocate, because you're the one that goes, something's not right, and go see a physician or a physical therapist, go to your doctor. You know first, and you know yourself, and you need to be your biggest advocate. With vertigo, there's a lot of cases and people that maybe, I just didn't feel right, but I live with it. Or, it's not that big a deal, I don't want to go to the doctor. Or, like you said, you not necessarily the symptoms of, I can't walk, I have zero balance. Maybe it's just slight. Right. Does that happen a lot, where people just like, I'm just going to live with this. It's no big deal. Or they may mention something in passing to their physician, but they're not mentioning the right things.
Right.
So your physician doesn't have the opportunity to run the right tests or go down the right path. That, I think, is one of the mystiques of vertigo, or the mysteries or the misconceptions, when you're talking about vertigo, because people are like, it's not, I just feel a little off. It comes and goes. It's like, I had no big deal.
You're absolutely right, Steve. This happens more than you can imagine. Actually, the studies are showing the number one complaint that people over the age of 60 come into their physician with is dizziness. That's the number one complaint that people complain about. Not that it's the most prominent, but the number of patients that come into their doctor's office will complain of some type of dizziness.
Which always makes me ask, it's like, how many aren't going to their doctor's office because they've got a little dizziness? Right. I mean, that's just a small sample size because, I'll live with it. Especially in the upper Midwest. There's a lot of people that just feel like they can just live with it. I'm just a little dizzy, Right, exactly. But why live with it when it can be corrected? Right. So another stat that's been shown. Would you live with a broken leg?
Right.
No. But in a lot of cases, with vertigo, it can increase over time. So, and we're a little bit of a victim of that, because it's like, well, it might start out as something a little bit off, and you don't, I don't want to see my doctor.
So another stat that I can
and then it gets worse and worse and worse, but incrementally, and then now you're dealing with something that you would have gone to the doctor if it was that bad to start with.
Right. So another stat I can share, that by the time you're 60 years of age, 50% of people will have experienced some kind of dizziness, kind of 50%.
Wow.
Will have experienced some kind of dizziness, some kind of vertigo symptoms already. And that number just goes up as you approach that 60 or 70 years of age.
Because so is vertigo, and again, vertigo is just a symptom.
Right.
But is vertigo in whatever the root cause of that, something that people as they age really need to be cognizant of? Because we don't hear that come up.
Yep.
I was telling you during the break about my grandmother and she finally found a chiropractor because she'd been to the doctor. I don't want to say misdiagnosed, because I'm not sure she gave him the right information, but she was having dizziness, balance issues, the vertigo stuff, and she was just trying to deal with it. Before I'm like, no, you need to go get this taken care of. And she had a chiropractor that was trained, that was actually being able to reposition her, and she did that probably once a year, and everything was great.
Yep.
But hers was the calcium crystals. But
so a lot of times
other conditions that present themselves as vertigo symptoms as you age.
So a lot of times it can even be the same condition that we're talking about, but patients don't know how to describe it to their doctors, or like we even said beforehand, they have a bunch of diagnostic workup tests that show that there's nothing going on, or they all come back negative, and so the doctors may not know the specialized route of sending them down to somebody else that can maybe diagnose that. So they just go, well, it's just something I have to live with. Well, no, like you said, the patient should be their own advocate. They know there's something wrong, and know then that there is something that can help you. 90% of vertigo cases or dizziness cases come from the inner ear, and that is what we're trained to alleviate, trained to treat, is inner ear dysfunctions. And so more times than not, there is help for you out there. So like I said, testing may show that there's nothing going on in your brain, or there's nothing going on, with the heart, or there's nothing going on in different areas of the body. And there may not even be any kind of diagnostic test that can show that there's something happening in the inner ear, unless we get into a specialist like us to test those functions of the inner ear and see if there is any of those problems happening there. And where we find those problems, then we can diagnose it and we can get on the right treatment path.
Are there cases where because again, everything is interconnected, and if something is out of whack here, then it can throw something out way over there.
Sure.
Are there cases that are really hard to diagnose because it's a multiple?
Yes.
It's this, but that's causing a little bit of this, which caused a little bit of this, and it's a cumulative effect.
Right.
And now somebody's presenting with symptoms of vertigo.
Right.
That's going to be a hard case.
Yeah, absolutely. So like I said, 90% come from the inner ear, but that other 10%, it can be coming from heart conditions to where they have high blood pressure, and they need to be connected with us, connected with their medical physician, connected with their cardiologist, to where we, as a disciplinary team or a medical care team, kind of take care of the patient because it's coming from the heart. Or it could be diabetic symptoms, could be coming from the neck. To where, they need to work with us and they need to work with their chiropractor for right adjustments or making that neck health feel better, which would then help some of those dizziness symptoms that are coming from the neck area. There can be a number of different things that can bring on dizziness symptoms other than from the inner ear that we would team with other medical professionals to help get you on the right path again.
And we're talking with physical therapist Jay Steckler over at Essentia Health, talking about vertigo this morning. And when we come back from the break, I want to talk about different treatment methods because, again, vertigo is just a symptom, and a lot of people have it. A lot of people live with it. A lot of people shouldn't because there's some treatment paths out there, but you got to know what the root cause is. We're going to talk about that when we come back. This is Talk of the Town on Super Talk 1270.
1270. Welcome back to Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bachman with Jay Steckler, physical therapist over at Essentia Health. And Jay, we're talking about vertigo, and a lot of people maybe not knowing the right questions to ask when they talk to their physician because they're a little off, something's a little different.
Right.
The diagnosis side of it, you really can't treat the vertigo because there's a lot of different treatment options out there, but you got to get to the root cause first. And that kind of starts with you as your own health advocate. Yes. Again, I'm a big triad of care guy, and you need to be your best advocate, which a lot of people don't know the right questions to ask. So if you're a little off and it's some balance or dizziness or a little, I almost want to call it a little bit of a malaise or a fog with vertigo that happens to a lot of people. And hey, we're tough. We live with it. But knowing the right questions to ask when you talk to your physician, because you got to give them somewhere to start to going down the right path of trying to get to the root cause of what is ailing you. Sure. What are some of the things, symptoms, signs that people need to be aware of so that when they're having that initial conversation with their healthcare provider, they know the right things to say so that you can, because medicine's in a lot of cases tends to be a lot of detective work.
Yes. And
putting your detective on the right path to begin with is vitally important.
Yes.
What are some of the things people should look for? What are some of the right things people should tell their healthcare provider?
It's again, like you said, they need to be their own advocate. They know there's something wrong. They know that there's something going on inside of them. That just doesn't feel right.
I just feel a little off.
Right. Some people don't even know how to explain it. And
first of all, drink enough water, hydrate.
That's right. And so they'll go into their medical professional, or they'll go into their doctor, and they do a battery of tests, and everything turns up negative. And so you go down the right. You still don't quite feel right
because a lot of people drop it right there.
Right. And so they just go, well, it's
Doctor
either something that'll pass, or maybe it's just something in my head. No, it doesn't have to be that. It can be something that doesn't show up on tests. So bring it up to the doctor because
vertigo
trained.
Is so hard to you've got vertigo.
Right. Well,
it's one of those hard ones.
It's one of those general symptoms that people just kind of, I don't want to say brush over, but it's a secondary symptom to where we're gonna take care of more of the important things, the heart issues, the diabetes, and so they're focused on these major health issues that it kind of gets, I don't want to say pushed to the side a little bit, but it kind of gets forgotten about. And so bring it up to a doctor. I go, hey, I heard of physical therapy. Physical therapy can help with some of these general feelings of dizziness or malaise or, wooziness, fogginess, spinning type sensations. Can I go see a physical therapist? And they would be absolutely happy to send you. They can write you up a referral there, and we can get you in for an appointment and get you checked out.
With physical therapy, and because physical therapists provide a lot of relief for a lot of different things.
Right.
Does somebody always need a referral to go to a physical therapist?
Typically, there are some insurances out there, Blue Cross Blue Shield of North Dakota, Sanford Health. Some of those insurances you don't need a referral, but most insurances you do need a referral. So it's always best to kind of check in with your healthcare provider. If you don't have a primary doctor, you can go into any Today clinic, walk-in clinic, grab a referral that way. It's a real easy process. But
it's been a big change in medicine. It's not
absolutely
like your primary doctor, because we're so transitive as a society. It's like, hey, walk-in clinic. There you go. I get a lot done there.
Yep. Most insurances, will require that referral, but it's easy to get. You see a healthcare provider, you can grab a referral, and we can get you set up usually fairly quickly.
Okay, we've talked about vertigo and a lot of different root causes of vertigo being a symptom. Give us a positive outcome. Somebody's walked in, they've lived with this, it's been a horrible experience, but, we're tough in the upper Midwest. We're here in North Dakota, so we kind of stick stuff out. Somebody's walked in and you've changed their life by getting rid of their vertigo.
Yeah, absolutely. I've had numerous cases of this. Like I said, I just saw somebody last week who was dealing with vertigo symptoms, room spinning sensations, had seen their doctor before, really didn't know what was going on, and didn't really go down this option, or maybe the medical doctor didn't know that we treated vertigo, or didn't think of it, but didn't know that there was the option. The person had these spinning sensations or this dizziness for over 5 years. And they came in and we corrected that within two treatment sessions, and their life is back to normal now. I mean, they feel like they did before the vertigo started. So numerous different success stories like that we've had in our clinic are
life-changing for a lot of people.
Life-changing, right? Because they can go back to work. The guy had a hobby of working on cars, and he couldn't do that anymore because anytime he laid down to roll underneath the car to work on it, he couldn't do it because he'd get dizziness. He'd get those vertigo symptoms. Now he could because we cleared up that vertigo. And he was so happy to have his hobby back, to have his life back, to where he was just grateful.
Well, and I think of somebody who just something as simple as bending over to wash dishes or
absolutely
tie your shoes, and you can't do it.
You can't do it, right?
Just
because you start
it.
Spinning.
Yeah,
right?
Absolutely debilitating. Vertigo, a lot going on. If somebody who's got questions, what do our listeners need to know? As far as, okay, I've got some questions. I may have been living with some of this.
Right.
How do they get in contact with your department?
Well, first off, our department is located in Essentia Health. The address is 401 North 9th Street. So it's on the corner of Rosser and 9th Street in Bismarck, just a block north of CHI Hospital. That's where we're located. So if you wanted to come see us, you definitely can come see us. But like I said, you'd probably need a referral beforehand. So contact your medical doctor. If you can't get a hold of your medical doctor or don't have a primary medical doctor, go to a Today clinic, go to a walk-in clinic, grab a referral, and you can definitely come in to see us. Number to get a hold of us is 712-4237. I'll repeat that, 712-4237. That's the number to our department. So if you even just have just some general questions, call into our department. Our front desk can patch you back to my line, and I can get back to you with any kind of questions that you may have as to whether we can help you or not.
Website, of course, always a great resource. What's the Essentia website?
So Essentia Health, it's www.essentiahealth.org. You can go on there and find a whole bunch of different resources that Essentia Health provides, but we would be in that as well.
Jay Steckler, physical therapist, talking about vertigo this morning on Super Talk 1270. Thanks for coming in.
Thank you for having me.
Talk of the Town, weekday mornings starting at 9 on Super Talk 1270 and the free Super Talk 1270 mobile app.